This is Parkinson. I'm glad you came in for a cleaning today. I did some assessments as part of your cleaning. Can I talk to you about what I learned from your assessments and some techniques that will help you keep your teeth and the bone that surrounds them healthy and in good condition?
Yeah.
Okay. All right. We went through your medical history, and you're a fairly healthy person, so I didn't see any concerns that from anything from that would contribute to your oral health, so that's great. We did some other assessments. You probably felt this kind of probing around your teeth with our instruments, and in doing that we were able to check your bone level and check for gum disease, and that's what we were doing with that assessment. That helped us kind of evaluate where we are with that, and we did notice a couple things and a couple concerns that we have with that. And so I just wanted to show you, I want to show you this chart today to just kind of show you what we found in your mouth. This is a situation, this is the instrument that we were using. This is called a probe. And you can see there's a color change on this probe. Every color change is 3 millimeters. And you see this is a tooth. This pink right here is the gums, and this kind of white right around the tooth is the bone level. Okay. There is a little pocket area right between the tooth and the gums, and that is what we were measuring with that probe. And a normal pocket depth is about 2 millimeters. You can see that's about 2 millimeters right there on that probe. Okay, and you see how healthy and pink this gum is. 2 millimeters is a very healthy depth. And up here it shows a picture of the nice pink gums around the teeth. And what is really important in this picture is you see this bone right here, how it comes up. It's nice and rounded at the top and near the top of the tooth. So that's a healthy situation. I'm going to turn here, and you can see what we have here. Same thing, the probe, and you can see it's down in that pocket area. But what's different in this picture is you see that the gums are they're red, and they're inflamed a little bit. This is called gingivitis, and what happens and what causes this is, you've heard the word plaque before. Plaque is just bacteria. That's all it is. A lot of people think it's food. It's not. It's just bacteria. And that plaque gets down in that pocket area, and it causes an infection of the gums. That's called gingivitis, and that's what this is. And what happens is the body sends more blood to that area to try and help take care of that bacteria. The gums bleed easily. Sometimes they'll even bleed when you brush from gingivitis. Gingivitis is completely reversible. All you have to do is clean the bacteria out of that pocket area, and within a day or two it will be back to that healthy normal. Okay. Notice the bone is still here, so it's just the gums that have been affected. What I want to show you next, and you have a few areas in your mouth that are in this stage. Okay. This is called gum disease. That's a term that's used for this. It's another term is periodontal disease. Okay. And interestingly enough, even though it's called gum disease, it's actually a disease of the bone. Okay. But what happens is this plaque, and you can see that yellow on the tooth. Plaque is the consistency of it. It's bacteria, but the consistency of it is similar to honey. It's very sticky like that, and so it takes quite a bit of swipes across that tooth with the brush or the floss to remove that stickiness. But what's happening in this picture is you see this dark. That's called tartar. You've probably heard that term before. What happens is that plaque, over time, if it's not removed, it will start to harden and become stuck to the tooth. And then you can't get it off at home with the brush anymore. You have to come into the office, and we go in, and that's why you're here today, for that cleaning, where we go in and we remove that tartar. But what the tartar does that's not great is it also is a rough surface that more plaque can attach to. And so kind of round and round you go, you get more plaque, and then there's more tartar. And so it's kind of a circle that goes round and round. But the concern here is you see there's still gingivitis. But what's happening with the bone right there? Can you see that? It's starting to dissolve away. When bone becomes infected from that bacteria, it doesn't even stay around to try and fight. It just simply dissolves away. And you'll notice here also that probing depth is about at a 5 millimeter now. Okay. So, and unfortunately, this bone won't ever come back. Once it's gone for good. And that's the concern with gum disease. It's It's not something that we can reverse, so it's really, really important to prevent.
Okay.
Okay. Now, just to show you down the road, I don't think you're at this stage yet, but I just want to show you what could happen if we kind of head down the same road. You can see more plaque, more tartar, and even more. And at this point in time, what will happen is you'll start to see the tooth will be moved back and forth.
Oh. Okay.
Yeah.
That's not good.
And no, it's not good, because then for chewing and that type of thing, it's and you can eventually get more infections from down in this area from that. So and then you're far from that. We're not here, but I just want to show you. And that tooth would also be very, very would be moving quite a bit.
Okay.
And so I want to teach you about flossing today.
Okay.
Okay. What is your feeling about the floss?
I'm not a good flosser. I don't like to take the time.
Yeah. Okay. Is it a difficult thing to do? Do you have trouble when you're in there? Does it feel
Usually I just want
awkward?
to go to bed. I
Okay.
can probably do it, but I just don't want to at that point.
Okay. All right. The brush is really good at getting the fronts of the teeth and the backs, the tongue side of the teeth. But in between the teeth, that's where those problems in those pictures that I show you happen most frequently.
Okay.
And because that plaque gets down in there, and it just kind of stays down in there because the brush can't get to it. Does seeing those pictures at all help you want to floss those areas and remove that plaque more?
Yeah, I do that.
Okay, all right. What is a goal that you think that you might be able to set that was a reasonable goal to be able to set for to floss? Maybe a weekly goal.
I could do it a couple times a week.
A couple times a week?
Yeah.
Okay. Are there certain days in your week that are less stressful than others that you would maybe set regular days that you could floss?
I could do it every Sunday night, and
Okay.
then maybe midweek, like on Wednesday.
Okay. Good. All right. That's great. I like that because it's kind of spread throughout the week, so that's great. And I find what happens a lot is patients will come in and they get very motivated after a cleaning because the teeth feel nice and clean and they want to keep them clean, but then they do really well for a couple weeks, and then after a couple weeks they start, you miss a time, and then it's easier to miss it, and then you think, oh, I just messed it up, But I want to tell you that every time you floss, it makes a huge difference. Okay. So even if you missed a week, reset Sunday and jump back in there, and keep, because we all have days that we get busy and that type of thing. So try to do it as regular as possible. Okay. Even if you miss days, jump back in. It'll be worth it. Okay. All right. So I'm going to show you how to floss. Let me get my. So I'm going to have you hold this mirror for me.
Okay.
Okay. So what I like to do is I like get a piece about that long. You can even do a little bit longer. That might be. And I like to wrap it around my middle fingers.
Okay.
Okay. Because that allows me to use I have these two fingers to really grab and maneuver that floss with. Okay. All right. So I'm going to have you watch in that mirror while I show you. Okay. All right, so what you want to do is you can seesaw the floss back and forth if you need to. If the teeth are tight together and you need to it's hard to get down in there, you can seesaw it back and forth. But once you've kind of gone down below that tight spot, you don't want to just seesaw back and forth like this. The reason why is because that pocket area is right down here. So if you stay up here and you just seesaw back and forth, you're only really getting one spot on the tooth. Oh, okay. What you want to do is wrap it around the tooth, kind of like it's a C. You can see that C shape, and then up and down, scraping that whole surface. So you're going all the way down into the bottom of that pocket and then all the way up to where those teeth meet. Okay? And then you can pull it forward and do the same thing on that surface, that up and down, that scraping. And what that does is it just peels that bacteria off the tooth surface. Okay? So what you want to do is just kind of go around your mouth, tooth by tooth, pull it forward, up and down, and then push it back, up and down. Okay? And after a while of doing this, you'll actually get really good. And it'll be a quick thing. You'll learn how to move that floss through your mouth, all the intricacies of your own mouth and where it fits and how it works the best.
Okay.
So I'm going to have you hold that floss.
Okay.
And I'm going to hold the mirror for you. And
Okay.
try wrapping around your middle fingers. Good.
Okay.
Okay. Okay, so it'll be a little easier for you. Come out for just 1 second.
Mhm.
Do you see how much you have in between?
Uh-huh.
That is a lot to try and maneuver. Try wrapping it around one more finger, one more time. Now try. If you have a smaller amount here, it's a lot easier
Oh.
to, yeah. Oh, see how much easier that is.
Oh, yeah.
Good, yeah. Okay, good. Good job. Okay. And you'll get better and better at it the more you do it.
Cool.
So, okay, wonderful. So we've set some goals with the flossing twice a week, Sunday and Wednesday. So when you come in your next cleaning appointment, I'll ask you about that. We'll see
Okay.
how that's been going for you.
Sure.
And then we'll also be doing the probing again.
Oh, okay.
And so we can see if those measurements have gotten better for
Cool.
us. And I really think they will, especially if you're flossing regularly.
Okay.
So, all right, thank you.